just because person-centered care also says mind, body, spirit. So, I think making that distinction is going to be hard, and I'm going to predict that transportation is going to be the least, because transportation seems a little bit more limited in its scope. So I don't know if we do want to switch it to 3 groups instead of 4, but I'll leave it up to you. That's just my prediction.
Okay.
My observation is that work going on in the transportation space now, but it's very important, and it's not something to be at, but it is the single most distinct of the categories.
Agreed.
Yeah.
Agreed.
If you do click on the link that's in the chat box, you will be forwarded to the page that Andrew is working on, and you could add your there's Post-it notes and things that you could add and comment on.
Yes. So I apologize. We're flying a little bit by the seat of our pants here, but is everyone able to access that link?
No.
Mine says the organization won't allow. Access denied.
I'm not accessing it either.
Okay.
Yeah, same thing here.
Well, my apologies. I think what we can go ahead and do for now then is for the people who are able to access, if you wouldn't mind helping us capture some of these notes here, and then we can kind of view some of these comments and discuss them here as a group. So I know that there were some comments that we had made before about distinction. Physical and holistic health. Oh, shoot. Okay. All right, let me double check here. Okay. Sorry, and Mark, would you mind helping me categorize some of these as well? Okay, thank you.
Absolutely.
Sorry, Mary Jo, I see you've got your hand raised.
I was wondering if, in the interest of whether we could into the chat the group that we would like to join.
Oh yes, that would be great.
Good idea. That sounds like it's easier to do.
Yes.
All right, so if you could put your name, and then where you would like to be assigned which group, and then we'll talk about the groups themselves and if we need to combine.
And actually, just for I have a Google form here as well, so I can submit this after the meeting. Just since we've been having some of these technical issues, and we can have a meeting list and subgroup organization set up after this meeting as well.
Andrew, can you keep track of what the chat?
Yeah, well, I'm taking notes on the chat.
All right.
Yes, and as part of the meeting recordings, I'll knock on wood since we've been having some other technical issues, but Google has told us that we will be able to view the chat logs after these meetings as well.
Oh,
So.
good. Oh, good. All right. All right. That sounds good.
Marlene, I see you've got your hand raised.
Too bad I didn't put some money on it. Looks like my prediction is right.
I was going to say that I agree. I think you're going to come up pretty on target, I think.
Mark, what about the composition of this committee? Really doesn't reflect the composition of the state of Maryland.
Yeah, we tried our best to, we had a number of folks and there was a whole process that was included in the application process. People did try to provide a ton of individuals to participate in this, and we did our best to try to reflect not only the areas of expertise, but all of the social parts of what we were trying to do. This is what we came up with.
Well, I wonder how many of us have experience or knowledge about, for example, the Hispanic communities and what the barriers are within the Hispanic communities. Montgomery County has a huge Hispanic population.
Yeah, no, I would definitely agree.
And it's not monolithic. There are Hispanics from all over, from different communities.
Definitely something that needs to be addressed. And again, we tried to populate these work groups as best we could with the people who volunteered and
Right. I understand.
Al was talking about the Latino Provider Network he's part of. Al, are you still with us?
Are you talking to me, Rhea?
Yeah.
Say again.
You talked about the Latino Provider Network. Is it in Maryland?
Yes, it's in Maryland. It's mostly city oriented right now.
Uh-huh.
It's got a couple of 250 members, and it's gradually working its way into Baltimore County. It's as an extension of what it does. It's all, well, it's a police department. It's Johns Hopkins Hospital. It's Towson University. It's real estate groups, a couple of banks. It's all social service agencies. ICE is involved, and all that sort of thing. So it's quite active in the city, but of course appeals to the whole population. And in Baltimore County, there is an immigration officer there that's an advocate for all those policies related to that under Johnny Olszewski, the county exec. So that's a growing population, as we all know, which really has to be included in what we do, in my opinion.
That's right. That's good to know.
Oh, I was just going to add, I just more from Howard County. And I'm sure with the Department of Aging, you just look at different age bands and the demographics change. So if you look at the school system in Howard County, you get, majority minority. And if you look at the population we neighborhood serve, that's still 70% white. So that, that's just natural. I'm sure that's all wrapped up in this as well.
Yeah, I totally agree. And also the age bracket is not the same. 50 is different than 60, different than 70. So it's not, because I know from research, sometimes they lump all people over the age of 65 together because it's the Medicare number. But, they are really a heterogeneous group of people, different challenges for sure.
This Maryland Senior Citizens Hall of Fame, our awards coming up, is selected 25 people, and the average age is 80, by the way. 80 people, which I think, and it's balanced, by the way, in terms of the volunteers. It's a balance between the men and women. I thought it would be mostly all women, but we've got, like in the 25, it's 13-12. Women are winning by 1. That surprised me to see that kind of balance, because usually you're going to find females.
Yeah.
And by the way, the volunteer work, we're talking years of what people had done to Naval Academy and all, as well as one poet laureate over in Prince George's County. I can't wait to meet her on October 17th. A poet laureate. How many people know one?
So, Mark,
We are just,
the
thank you.
complexities of the population suggests that for us to come up with recommendations within 2 months seems to me pretty unrealistic.
I sort of agree, but we've got to look at, just like Mark was saying, that not reinvent the wheels. But I think we need to rely on your expertise and your knowledge of the system to know what works and what doesn't, and I think that's going to be important. I worry about, evidence and recommendations because, as you know, we don't have just a great models of care that is evidence-based for the oldest old. Everything we know is extrapolated from trials on a younger group. So, I just worry about this a little bit, but it's a learning process for all of us. By the way, Al, I don't know, you mentioned the poet laureate. Do you know Grace Cavalieri? She is the Maryland Poet Laureate, and I think she's 97.
I don't remember the details. The lady's from Prince George's County and also speaks on behalf, I think, of Cecil County or Carroll County. So that's all I know from memory, but I have records here. I can get to those if you want to know more details.
Yeah, no, we met Grace. We have her come for a poetry session every year to work with the medical students. She still writes poetry. I think she's 97. She's our Maryland laureate. She's amazing.
That head of our group, by the way, is 95 of the Maryland Senior Citizens Hall of Fame.
Alrighty. Andrew, are we done with everyone?
Well, I have a whole list here going. I don't know if you do, Andrew.
Yeah, I've been capturing some of these notes here as well, but
Should I put it?
I don't
in
want to
the-
overstep
how do you
our
wanna-
bounds,
how do you
but
wanna
I
organize it?
realized that we are set to end this meeting at 12 sharp, which is in 15 minutes here. So with the permission of the chair and the folks here, I think that some of these conversations that we're having here might be better continued in our next work group meeting. And we can include some forms offline as well to try to make sure that we have these groups set up and have that work cut out for us in a way that's manageable and best understood by everyone. So we can continue this conversation in our second meeting and start working on some more of that policy formation and identifying those areas that we'd like to work on in that second meeting as well.
Yeah, thank you, Andrew. I think that's an excellent, it's up to this chair, obviously, but I think that's an excellent suggestion. And we have captured the comments and the areas that you guys are interested in. So we'll give us an opportunity to kind of collect all of that, and then we'll hit the ground running at our next meeting, if that's okay with the chair.
Yes. I just wanted to say that, the person-centered care is exactly what Mark talked about, which is the 4 M's. It's the holistic look at the person. The mobility matters the most, the mobility, the medication. So that's really the patient-centered care, the person-centered care. I think the transportation, we all know, and I can't really emphasize how interrelated those are. Like the people that don't have good transportation, broken sidewalls, and they can't walk, they also reflect on the patient-centered care and interact with physical and brain health. The physical and brain health, the multi-morbidity, dementia, and then sense of purpose. I think it's across the board. So it just it dives into all of those, and it's not necessarily for someone who's ill. I mean, that loneliness and sense of purpose it's just a common denominator for all of us across age groups.
I think some of the thinking as well with the organization of this meeting is that once we do break ourselves into the various groups, we can meet. We don't have to meet when these meetings occur. We can set up meetings in between or email each other in between and work on this in between. So I just wanted to say it's up to the group, but once these subgroups are established, that there may be meetings, in person, off site, or I don't know how the subgroups want to meet, but that may be a way for somebody who's, I know that Kim was talking or asking about joining 2 groups. I think if we did it strictly based on this meeting, I don't think you could be in 2 places at one time, but if they are broken out and done work individually, we can have 2 groups, 1 person working 2 groups. I'm trying to see the other requests. Mary Jo, go ahead.
Have you named name the work group heads, or work groups nominate the heads themselves once?
Yes, ma'am. We'll have leads of each of the subgroups, I believe.
Have you already, no, my question is, have you already,
Those subgroup names or heads have not been named.
no, okay. So who named,
It's up to the group who feels comfortable reporting out. And we're just trying to get the structure of this squared away at this meeting. And it's up to who feels comfortable representing the group that they belong to.
Yeah, so to share a little bit more, the subgroups are intended as more of a way that we can have some more focused conversation with 4 or 5 different members at a time. That way we're not trying to all speak over each other in this main group meeting. So what we might want to examine as well is if there are individual topics of conversation, we can have those be more amorphous work groups. So that people can comment on the things that are most of interest to them during that meeting, perhaps. But the subgroup organization was, again, initially set up so that we can have some more of that focused conversation among 2 or 3 people. Marlene, I see you've got your hand raised.
So do we want to do the 4 subgroups and we'll go to the rooms separately and have the last 10 minutes chatting, or?
I'm almost hesitant to break into the subgroups actually right now, because we have to kind of organize it. We're 27 or 25, 27 individuals. And I think in a perfect world, I would be able to do it, but I don't know if Andrew has the, I would rather get ourselves squared away and as to which subgroups, and then at the next meeting, go back and break out and spend almost all of the meeting doing those subgroups, if that's okay. That's my opinion.
Yeah, I would agree with that. Sorry. It's a Friday the 13th. We're having all kinds of technical issues, and I apologize for that on our end. But we will be prepared to have that set up during the next meeting as well.
If you need a massage, give me a call.
Thank you, Al. Sorry, Casey, I see you've got your hand raised.
Yeah, sorry if I missed this, but should we list 2 group preferences since they're trying to balance them? I know I only listed 1, but there are 2 if that would be helpful.
Yeah, so I know that there are a couple of folks on this committee who weren't able to make it to this meeting as well. So what I can do is send out a form that hopefully will work for everyone, where we can provide first and second choice to assist with some of that balancing.
Sounds good, thank you. I know Google gives a little bit of trouble when you try to include people outside of the government system, so.
Yeah, and some of our wonderful IT folks here are moving us over to the Smartsheet system as well, which I know plays better with some people outside of a typical Google organization. So we will get this issue fixed.
Awesome.
I'm just jotting down the folks that I have in each of the groups here in the chat box.
In the interest of having a finite end to this meeting as well, Dr. Kerbeck, I know that you had shared that there were some things that you'd like us to focus on for going into the next meeting, as far as identifying legislation or causes. So I want to pass it off to you for.
Yeah, so I wanted to say again, thank you so much. I think we didn't get a chance to do everything that we wanted to, but I think it was just an amazing, great opportunity to get to know each other and to know the breadth of knowledge that's really incredible in the room. So I think, I don't know, do we have a meeting scheduled for next time?
Yes, sorry.
It's
I had
October
originally
2nd.
sent out that poll. Yes, and
okay, so we have it already set. So I think we, on our end, we have the homework of just taking all the participants, try to create the work group, ensure that it's balanced, and make sure to go back and talk to people that want to be in two different groups, hopefully not in the same time. And I think we need to tap into as many experiences as possible. So I think the next time we meet, it would be, most of the breakout room and discussion within each and every one. What I really would like to reach out and ask, if you have resources that is available to you that you would like to share with us. Again, it's about really having your cumulative knowledge translated into like policy implementation. And so we wanted to know if you've had systems that worked, if you've had policies, if you had even storytelling anecdotes. I think it would be helpful to us. Andrew, do you have like a folder where people can drop things in the all of us would be able to put resources, and maybe they're categorized into the 4 domains that we just talked about?
Yeah, so we do have that Google folder that I shared access to in the meeting or in the notes for this meeting, but I will make sure that we follow up after this meeting as well and have that better organized and make sure that everyone is able to access.
Yes.
So if anyone is not able to access Google Drive, if you could please send me an email after this meeting, and I will make sure that we have that figured out.
Okay, thank you.
I think I've kind of squared away what I have down, although we do have one more person, Mr. Sanders, in the social connection group. All right.
Mark, I mistakenly typed you and then the message. Then I just sent you one that said U equals Muehlberger. So wherever you see YOU, that's me. Sorry, I apologize.
No, understood. No, thank you for the clarification. And again, I want to thank everybody for their patience. You know, this whole Longevity Ready Maryland is a new process for us, and we are all learning together. So we will have the meeting a little bit more squared away at our next meeting. So please forgive any of the technical glitches. And I think we spent more time than I anticipated on the introductions, but I think that's an important piece of getting to know each other and knowing what our backgrounds are. So I think that was time well spent, which took away from some of the breakout room areas. But I think we're in the process of getting ourselves organized and are in good shape to really hit the ground running at our next meeting. Which, for the life of me, at the top of my head, I couldn't tell you what the date is.
October 2nd.
October 2nd. Thank you, sir. I appreciate it.
October 2nd from 11 a.m. to 1 p.m.
Thank you. I appreciate it. Off the top of my head, I couldn't pull that out. So, yeah. So I think once we really get a feel for what our interests are, then we can kind of really nail down how they overlap and how we want to maybe change the names of some of this and make sure. I mean, one of the concepts was changing the transportation mobility into really access to care. And I'm not sure that still speaks to mobility necessarily and transportation, but I understand how it fits. So I think we need to kind of think about making sure that we, stay within the scope, but also address. But I certainly understand how it could be, seen as access to care. But I think it's beyond just access to care and looking at infrastructure almost. But that's my opinion. I just share it.
You're so right. I mean, I look at it as disability justice. It's part of equitable society. It really is about justice. I also wanted to say that please reach out to the to our contacts. If I know, as far as I'm concerned, feel free to email and keep the conversation going. I think that's going to be very helpful. Really a learning process for all of us.
Have everybody had the opportunity to access the shared folders that we have and take a look at the resources and all of that? So yeah, please take a look and make sure that you're comfortable with sharing information, and please add information to that. You know, part of that work, you know, that work section, that working document section is for us to use to kind of share with each other. So, you know, we can try to organize it a little better as we move along. And once we get the work groups down, the subgroups, we can have folders for each of the subgroups and just have that be a place for people to have communication when we're not in these meetings itself.
That's right.
And thank you and Andrew and Rhea for the work you're doing for us.
Well, thank you.
Thank you all. It's been really great being part of the group, and looking forward to more conversations and more learning and growing together.
Thank you, Dr. Kerbeck. All right.